So welcome to our system, XanaHealth. XanaHealth is a product by Karisimbi, and I'll be taking you through how it works. So normally when you reach the hospital, everything you'll see us do through this software is usually done by using paper, and all these papers stored in cabinets. So there's manual retrieval and entering of data and managing the whole hospital operations, which is something that you're trying to change. So first and foremost, when you get to the hospital, the first thing that happens is, let's say the receptionist. The receptionist will log in, the one who receives the people at the hospital, log in with the receptionist account. If it is not your first time visiting, let's say for example your name is Jen Doe, you can find a record of your treatment here, and then if now this is, you can say new visit. If this is a second time you're coming, you can have a new visit. But let's assume it's just the first time you're coming to the hospital, so we create a new patient file. Up there, we put in a random name, James Bond. So there are certain details that are compulsory for you to enter. For example, the dates and the location from which you come from. The national ID is not necessary, but we can always put it there for to use it as a unique identifier just in future. And then we put in the town which you come from. The demographics are compulsory. After creating your file, we can submit, and you'll have complete. Now you have your own medical history and your own patient ID there. So what we do is we say new visit. So today you're coming to the hospital. We ask you what has brought you here. Which department are you here to see? Dental, general consultation. You've come for lab tests or nursing care. Let's say general consultation. We assign you to a doctor, Dr. Cedric, which insurance you are using. You can either be using private and a private insurance provider, or the Rwanda Social Security Board insurance. So let's use this one for example. Your card number can be 12345, and then your how much do you, so patient copay is how much do you contribute to the insurance payment. Let's say for example your insurance covers for everything, so we say zero. Voucher number, we just add 17 or any other random number. And then once the receptionist has put in these details, affiliate name. So affiliate name is usually who is the principal, who holds the insurance, the principal insurance holder. Maybe it's your parents. So let's say James Bond comes from, the parent is John Doe. So you put John Doe, and then we submit. Uh, let's say father advance zero. Okay, we hit submit. After hitting submit, patient can proceed to consultation. If you see there, there's a notification, can proceed to consultation. So we go on the other side, and on the other side now, the consultation room, the consultation room is where the general doctor will find you. So the doctor also has his own account, which allows him to log in, which gives him certain functionalities that the receptionist does not have. So you log into the consultation room, and you see here already, if you go to the notifications, a new patient, for example, a new patient is waiting. So, for example, here is James Bond, the one we just created the ID for. So we click on James Bond, and we start we start doing. The doctor will do the preliminary exams, check the temperature. For example, we just put random numbers here. Temperature, let's say 38. I'll put if I put any unrealistic number, just don't mind. I'm trying to demonstrate how this works. Heart rate, whatever, and then you just put in random numbers and submit. That's what usually happens at the consultation, those general checkings. And then the chief complaints are what did the patient say they were feeling, headache, can say things like headache, uh, fever, see, we submit that too. And then let's assume now their physical, let's just skip over that and go to the laboratory tests. So, for example, the doctor may request certain lab tests to be done, and uh, they'll enter which type of test they want done. And let's say they want COVID-19 test, and you submit that. Once you're done, once you're done recommending what tests to be done, you've done the initial. Now it is for the laboratory to check on the patient and test. And this information has been sent there already. So you log out and log in as the lab technician to see if there's any lab requests that have been made. So you log in there. Then you come and realize that there's the notifications, new COVID test patient for James Bond. So you come to James Bond, you carry out the uh, test. Let's say for example, positive. Once you're done, you can print it. Usually, you can print it to give them the paper, but this is not necessary because once they go back to the doctor, let's log in there, back to the doctor, to the consultation room where you were. Once we log back in there, you can see that lab results, the lab results are out. So we click here and we can see, you see, COVID test. If you see around on the left corner here, lab exams COVID test came out positive. So you can admit into hospital or you can come down here and where is it? You can come down here and do what we call giving final diagnosis, where you say your disease, for example, final diagnosis tested positive for COVID 19. That's the final diagnosis. And then this patient now can be able to know the way forward, and the doctor can now like recommend now which medicine they need to take. And after all that process, we can come back here now. Let's go to the receptionist. We go back to the receptionist who is now going to print the whole bill for this visit of the patient. Come James Bond, and you're like billing. You come James Bond, click there and view invoice. So now you can see James Bond. In the price for the COVID-19 test was 5,000. The insurance paid for the 5,000. So this is the whole thing. And then also one of the things they can see is the sales report, where you can see throughout the day how many patients have been treated, how much money has been contributed by the insurance firm, and which department has brought in what amount of money, be it dental, lab or nursing care, and it can be printed and shared too. Other functionalities and reports like depend on the account that you are managing, but basically that's how the system flows. Thank you.